Let's hear from Dr. Tim Caroe, GP and Chief Medical Officer for Sussex NHS Commissioners. I spoke to him earlier and started by asking him how GP services are coping here in Sussex during this second wave.
I think the first thing to say is that GP practices across Sussex have done a fantastic job of continuing services at this difficult time. The Sussex GPs have changed the ways of working in order to work around some of the restrictions that have been put in place to keep people safe. So I'm really proud that throughout the services, people have kept open. They've kept seeing people who've needed it and just helped in an albeit different way. And some of those lessons that have been learnt through those difficult times are being put into practice right now and should help to carry us through this second wave.
Has there been a knock-on effect, though, on other sort of non-COVID services? I suppose there's a concern that people are falling under the radar as a result of the pandemic and maybe other conditions are going undiagnosed.
I think there is a real awareness of how important it is for people to still keep talking to their health services at this time. If they're worried about something, to not say, oh, I don't want to bother my GP because I know they're so busy. So coming to services as you would have done if you're concerned about your health. And the reality is, unfortunately, that there are things that have had to be brought back to prioritise some of the people who are vulnerable and at most risk of COVID. But GP practices are very aware of how they are needing to support all people at this time and prioritise as needed.
Do you think people are worried about going to the surgery, though? I mean, have you seen people delaying or cancelling their appointments?
I think the first thing is that people, in general, really want to help out their GP services. So there are some people who said, oh, I really didn't want to bother you, doctor, because I knew how busy you were, and actually have not come in. So that's the encouragement that if you feel that you do need help from your GP surgery, then please do contact them. In terms of how we keep people safe in GP surgeries at the moment, so there's a limited number of people coming into the surgery so that we can keep up those important things of social distancing, of wearing masks and keeping safe with hand washing. So all those facilities are available in order to keep the premises safe. And when I see people in my surgery, once they leave, I'm washing down and cleaning up everything there so that it's ready for the next person. But you can imagine that takes time in order to keep people safe, which is why we're moving much more to telephone and video consultations as well as online consultations as well, so that we can carry on giving the services to people they need, but in a slightly different way from the way they might have done that in the past.
An extraordinary time to be a GP, I would have thought.
It is absolutely extraordinary, but it's also a privilege to be helping people at this time when often people are scared. And what I would say is that general practice is there for you. And the things that we're using now in terms of online videos, so to be able, someone says to me, I've got this rash, and I say, oh, press this button and let's do a video consultation. Or when you've got a problem, just go online, let me know what's happening, and I'll text you back via the secure portal. The whole new ways that we're doing things are really supporting people. And that legacy of the way that we're supporting people now will go through into the future so that we can continue to be helping people in these new and innovative ways that often suit people better. Instead of having to come and sit for a GP appointment, having a quick video consultation is sometimes a lot easier for everyone. So although things have been desperately difficult, there have been some opportunities here that we'd like to carry on and help people into the future in different ways.
Well, listen, as always, a massive thank you to you and all your colleagues in the NHS. Dr. Tim Caroe, thank you for joining us.